Good morning everyone, myself Dr. Ravi Keshri. Today I will discuss about the spinal cord. Then we know that the central nervous system, it is composed of the two things, that is the brain and the spinal cord. The nervous system is divided into the central nervous system and the peripheral nervous system. And in the peripheral nervous system, there is the autonomic nervous system, and it includes the cranial nerve and the spinal nerve. That is the peripheral nervous system, the cranial nerve and the spinal nerve. Now the spinal cord, we will discuss today the spinal cord. And spinal cord, it is the part of the central nervous system. The spinal cord is a part of central nervous system. Central nervous system includes the brain and the spinal cord. The peripheral nervous system includes the cranial nerve and the spinal nerve. And the spinal cord, it is the part of the central nervous system. The length of the spinal cord is about the 45 centimeter. The 45 centimeter, it is the length of the spinal cord. And where is the located? Located in the the superior two-third of the vertebral column. Why in the two-third? Why? Because the growth of the spinal cord, the vertebral canal, occurs faster than the growth of the vertebral canal. Vertebral canal occurs faster than the spinal cord. So it is located in the superior two-third of the vertebral canal. Now, what is the extension of the spinal cord? It extends from a large opening in the base of the skull, that is called the foramen magnum. There are different opening in the base of the skull and the large opening, that is called the foramen magnum, and it extends from the foramen magnum to the level of vertebra, L1 and L2 vertebra in adult. But in neonates, this spinal cord extends, कहाँ तक extend करता है? To the vertebra level L3 and sometimes L4. यानी एडल्ट में कहाँ एंड किया? L1 L2 के लेवल पर. एडल्ट में नियोनेट्स में कहाँ एंड किया? L3 के लेवल पर. And sometimes the L4. Length is 45 centimeter, located in the superior third. Why? Because the growth of the vertebral canal, it occurs faster than the spinal cord, and it is located in the superior two-third of the vertebral column. Now the next term is the conus medullaris. Name is conus medullaris. What is conus medullaris? I will discuss. What is conus medullaris? The distal end of the spinal cord is cone-shaped. Distal end of the cord, this is spinal cord, distal end of the cord is cone-shaped. So it is called conus. Distal end of the cord is cone-shaped. So it is called. What is called? Conus medullaris. Suppose this is the spinal cord, and this spinal cord has the conus end. This is the conus end. That end is called the conus medullaris. That is the conus medullaris. The distal end of the spinal cord is cone shaped, so it is called the conus medullaris. Distal end of the cord, it is the cone shaped, so it is called the conus medullaris. And the foramen magnum, it is the large opening in the base of the skull. It is a large opening in the base of the skull. In the large opening in the base of the skull. And distal end of the cord, it is the tapering and cone shaped, that is called the conus medullaris. Now the spinal cord, it is uniform, it is not uniform in diameter, and two major swelling are present in the spinal cord. The two major swelling are present. One is the cervical swelling and the second one is the lumbosacral, and second is the lumbosacral swelling. The cervical and second is the lumbosacral, the swelling. And two major swelling, the cervical and the lumbosacral swelling. And it has two major swelling, that is the cervical and the lumbosacral swelling. Now the cervical enlargement. Now the cervical enlargement, it occurs in the region which are associated with the origin of spinal nerves. Cervical enlargement occurs in the region associated with the origin of spinal nerve, that is the spinal nerve, which innervates the upper limb. The cervical enlargement, it occurs in the region associated with the origin of spinal nerve, which innervates the upper limb. And second is the lumbosacral enlargement. Lumbosacral enlargement. What is the lumbosacral enlargement? It occurs in the region associated with origin of spinal nerve, that is the L1 to S3. This lumbosacral enlargement, it occurs in the region which are associated with